Causes and symptoms of platelet deficiency. And treatments. Immune disorder that causes bleeding, because platelets play an essential role in clotting and preventing bleeding. More clearly, platelets are specialized blood cells that help maintain the integrity of the blood vessel walls, and then help prevent and stop bleeding by accelerating the clotting process when needed. The normal platelet count ranges from about 150,000 to 400,000 per microliter of blood, but dangerous bleeding only occurs when the platelet count is less than 50,000 microliters. The problem of platelet deficiency appears through some symptoms, such as bleeding under the skin, which causes bruises, or small red dots on the skin called petechia. Bleeding may also appear within mucous membranes such as the nose and mouth, and in rare cases in the stomach, digestive tract and urinary tract, leading to low levels of red blood cells anemia, especially in women with very heavy menstrual cycles. Platelet deficiency. What are the symptoms? Some symptoms or signs indicate a deficiency of platelets, such as bleeding gums. You may notice blood on the toothbrush, and perhaps swollen gums and visible redness. Blood in urine or stool. If your toilet water is reddish and pale after you urinate, you may have blood in your urine. The stool may also appear very dark. Blood in vomit. Vomiting mixed with blood is a sign of upper gastrointestinal bleeding. Heavy menstrual cycle. If the menstrual cycle lasts longer than 7 days and the bleeding is heavy most days, this is a danger indicator. Red freckles. This condition appears as small red dots on your lower legs that resemble a rash. Bruises. Bruising occurs when blood collects under the skin. If you notice bruises appearing for no reason, this is a danger sign. Signs and symptoms may appear suddenly, and mild thrombocytopenia often has no signs or symptoms and is discovered during a routine blood test. Consult your doctor if you have any signs of bleeding. Severe thrombocytopenia can cause bleeding in any part of the body, and bleeding can lead to a serious condition. Then it must be treated immediately. Complications of platelet deficiency. If thrombocytopenia is left untreated, the condition may worsen and cause other, more serious conditions. The following are serious complications of thrombocytopenia. Severe internal bleeding. Low platelet count may cause intestinal bleeding or bleeding in the brain. Bleeding in the brain is a life-threatening problem. Heart attack. Persistent thrombocytopenia reduces the amount of blood flow to your heart. Causes of platelet deficiency. There are causes of thrombocytopenia. The following are the most common causes. Blood cancers, such as leukemia or lymphoma, which leads to the destruction of stem cells in the bone marrow. Infections. Some viral infections such as HIV, hepatitis C and chickenpox. Chemotherapy. Chemotherapy drugs and radiation used to treat cancer can temporarily damage bone marrow. Exposure to toxins. Exposure to certain toxins such as arsenic or benzene found in industrial chemicals and pesticides. Pregnancy. Pregnancy may cause a mild or temporary decrease in platelets, especially immediately before birth. Autoimmune diseases, such as rheumatoid arthritis and lupus, where the immune system attacks and destroys platelets along with some other body cells. Spleen disorder. The spleen is a fist-shaped organ, about 4 inches long and purple in color, located on the left side of the abdomen, just below the rib cage. Size and shape can vary slightly. It fights bacteria and acts as a blood filter. That is, it stores platelets and white blood cells in order to fight infection, and at the same time, it recycles old red blood cells. Pharmaceutical. Antibiotics that treat bacterial infections, medications for seizures and heart disease, and the blood thinner heparin may affect platelet levels. Methods of treating thrombocytopenia. You may not need treatment if your low platelet count is not causing you major problems. Often, your doctor can treat a low platelet count by treating the underlying cause. Steroid medications. These medications aim to increase platelet production, but they must be taken under the supervision of a doctor. Transfusion. In the case of very low platelet counts, your doctor may direct you to receive a blood transfusion to temporarily increase platelet levels. Blood transfusions may increase levels for about 3 days. Once your doctor finds the cause of your low platelet levels, he or she will take steps to help you. If you have thrombocytopenia, ask your doctor what is causing the problem and what treatment or changes will protect your life. Thanks for watching. Please like, subscribe, comment and share.